I'm here to speak about catalyzing investment to impact in healthcare. We are here to serve 1.4 billion lives. And for that, we need capital, systems, and conscience, which must together to create impact. Before I start talking about a vision for Bharat, for 1.4 billion people, I'd like to share about a personal beginning, which is before systems, before investment, before impact. I speak to you today first as a son. Grew up in a small town in India. Healthcare felt distant until it became everything. A routine diagnosis, just gallbladder stones, simple treatment, that's what they said. Only simple if you live at the right place. Limited care, incomplete answers, local healthcare was insufficient. Shifted to regional medical center. Diagnosis wasn't completed. Treatment lacked continuity. What we could have prevented. As a result, kidney infection developed, avoidable with early diagnostics and continuity. Healthcare failure wasn't dramatic, it was gradual. If not here, then where? Moved to one of the India's largest institution. There was delays, silos, and broken handoffs. No single villain, but yet the system failed. A world no family is ready to hear. Kidney transplant. Endless transfer between the cities. Medical files thicker than the textbooks. Hope constantly on the move. What truly went wrong? Not a lack of doctors, not a lack of hospitals. Right care did not reach us in time. In India, the outcomes depends less on disease and more where you live. There are three incomplete promises: accessible, affordable, and equitable. For 1.4 billion people in India, these are still unfinished sentences. Simple question that each one of us ask. What do we ask? What do we know about technology? What do we know about innovation? Where do we go if we get struck in a medical emergency? In India, the answer changes every few kilometers. Healthcare does not transform just because you want to spend more money, or chasing valuations, or following the buzzwords. Healthcare transforms when we invest deliberately, invest intelligently, and invest for the last mile impact. India's real problem is not talent shortage, no doctor shortage, no capital shortage. India does not have a healthcare potential problem. India has a healthcare execution problem. Execution breaks. World-class hospitals, only where patients can pay. Breakthrough technologies, which are largely stuck in pilots. Scale without systems. Progress without consistency. This is a design challenge, and it is not a vision, it is not a dream. Multi-specialty care everywhere. This is the vision. Doesn't matter where you live. Uniform protocols for diagnostics and therapy. Quality should be independent of wherever you are. It cannot be dependent upon geography. Distance should not dilute care. We have done impossible in India. Vaccines. In fact, half of the world gets vaccines from India. Half of the pharmaceutical products sold across the world are manufactured in India. We have done the perfection of process, quality, and scale. And now we have a very enabling digital public infrastructure, like the way we have witnessed something in fintech. Now, I think the next decade belongs to health tech. And I think it will be built at a scale which is going to be affordable, a low cost. The shift that we must make from numbers to methods, more beds to outcomes, more machine to better care. Healthcare fails due to poor processes, weak protocols, fragile system. Heurism does not scale, systems do. Quality and scale, they are not opposite, rather they are multipliers to each other. Bad systems collapses when scaled. Good systems strengthen under pressure. And I think this is what COVID taught us. we could really re-strengthen our Indian healthcare delivery during COVID's time. The future belongs to solutions that work on Monday morning, during power cuts, with limited staff, and in the real condition. The real nature of a problem. Healthcare problems are not just medical. They are operational, managerial, logistical. Examples, there are ideal machines, there are poor bed turnovers, doctors buried in a paperwork. Management is not an interference. It's actually clinical enablement for better outcomes of the patients. The last mile reality. Innovation must reach on time. India loses lives not because we lack innovation, but because innovation arrives too late. Last mile healthcare means early diagnostics, hyper local follow ups, and preventive care over emergency care. I think India needs to spend more money on preventive care than emergency response. And India has been known for a sick care than health care. And I think this is a transformation that we need to see in next couple of years to come if we were to truly call ourselves as Viksit Bharat 2047. And I think for that, we need something called collaboration. No single actor can solve this because we have a monumental challenge to deliver equitable healthcare to 1.4 billion people. Government alone is insufficient. Private sector alone is incomplete. Collaboration is the way forward and which will create the scalable impact. The role of startups becomes very, very important because startups can think disruption and bigger companies can think adoption. And when they get married, from disruption and adoption gets married, and that's when you build new solutions which can transform the lives. So disruption without execution can fail, and innovation without systems can collapse. Healthcare startups, which are scaling their venture from innovation to impact. But the hard question I want to talk about is survival versus creation. Problem solved versus funding raised. Sustainability versus speed. And the key lesson is, as Jeff Bezos says, there are many ideas. Ideas don't fail, but executions do. And that's what Indian healthcare ecosystem is about. Investment will ensure the systems grow, but it does not mean that inequality will further deepen. Impact investing essentially means, can it reach the scale? Should it reach where it's supposed to reach? Should it scale in the right unit economics manner? There is a lot of invisible work that matters. Unseen, unglamorous, essential, behind-the-scene effort that healthcare workers do it. For each single doctor, there are 7 paramedical forces that support the doctor to deliver outcome-based care. The clinical validation of innovation is a very, very important point to ethical guardrails. The real-world testing is very important, and I think what we are trying to build is an ecosystem where people can work together from innovation to where it is required, which is last mile. And if this does not happen properly, innovation just collapses under a scale. A message to Gen Z: you question access, equity, outcomes. Remember, impact is not accidental, it is engineered, it is created, it is causative. What engineering impact requires? It requires vision to see what could be. It requires discipline to build what must be, and courage to act when change is uncomfortable. If India gets healthcare right, the global implication is we just do not heal India, we heal the world, not by being cheapest or loudest, but by being most thoughtful. Reframing the 3 words: accessible, affordable, equitable. No promises, only operational realities. From son to an advocate, to a biotech, to an IP lawyer, to financer, to VC, I think the journey has been enormous. And I think what I've shared with you is about my mission, that how I can provide through my own journey a mission of equitable healthcare to 1.4 billion people in our country, so that no child wonders if their PIN code will decide their parents' fate or their grandparents' fate. And this is how we're going to be healing a nation. Thank you so much.